Hi, so I'm gonna perform nasotracheal suctioning. So first and foremost, make sure we check the patient's chart, obtain any important or relevant information. Once we're done taking those, make sure we wash our hands upon going inside the patient room. And then once inside, introduce ourselves to the patient, or even with the presence of relatives and even healthcare staff. And then try to explain to them what's the purpose of this procedure by letting them know that it would help relieve any secretions present in their lungs. So once you did those, make sure you check the ID band of the patient for any confirmatory purposes, and then make sure every time we do the therapy or procedure, reassess the patient, obtain any vital signs. Make sure we always check the SpO2, the heart rate, the patient's consciousness, and most of all the auscultation side and listening to their breath sounds. So once you're done, make sure we wear appropriate gloves and PPE such as a face shield, a mask, and even a gown to prevent us from any splashing fluids. And then we also have to set a non-rebreather mask in place. Make sure we try to observe this one to inflate, and then try to put it to the patient first, allow them to hyperoxygenate, and then we have here a suction regulator. Turn this one on, and then also try to observe the bottle if there are any cracks present or any misconnections. And then for the tubing, make sure that there are no kinks, no obstruction, and also most of all it's clean. And then we can also check the appropriate pressure if it's ideal for the patient. So for this patient, which is an adult, should be not more than negative 150. Set it there. And then after that, we can gather all the necessary supplies such as the sterile gloves, and even try to check if the catheter is in place, and even the lubricating jelly. So lubricating jelly, we have to put it in this clean cover of the basin, or even a gauze in place, and then leave it there. And then here we have a airway for the nasopharyngeal airway. So make sure we have a few or different sizes with us at all times. And then when measuring this, we can measure it from the tip of the nose until the ears, or even trying to viewing it the bevel if it's too small or too big for the patient. So upon inserting it, make sure we lubricate it with a lubricating jelly, and then inspect the nose for any obstruction present, for any deviated septum. We're gonna check it up and then insert it gently. So with the lubricating jelly, it would allow us to help insert the airway at ease. And then if you sense at first any obstruction when inserting it, we can try to gently twist it when there is any obstruction present. So that's how to do when inserting the nasopharyngeal area. So after that is hyperoxygenate again the patient. So with this, we can wear the sterile gloves above the clean gloves, or we can just remove it. And then wash our hands, and then make sure we choose which one is our dominant hand. So assuming this is my dominant hand, so this one will be the sterile area. So sure we wear clean gloves, sterile gloves. So this one is my clean hand, where I'm gonna grab the suction catheter tubing, and then this one is the suction catheter using my sterile or dominant hand. So you can hear a hissing sound. So first is try to check by re-sterilizing it after pouring adequate amount of sterile water until we sense there are water that we're able to suck it up. And then assuming also some physicians would like to obtain any specimen, we can put in between in this sputum cup, or even a mucus trap where it will grab multiple secretions on it. So after is we have to lubricate it in a lubricating jelly carefully. And then once you're done, remove the oxygen and insert gently to the patient's nose, even the airway. And then if we sense a first obstruction, try to let the patient cough if they're able to until such time the vocal cords will open, so that would allow us to insert it with ease. So once you reach to that point, suck it up. When doing the suctioning part, it should be not more than 15 seconds, it should be less than 15 seconds only.